Colonoscopy is a procedure used to help look for cancer or an abnormality in the colon. A flexible colonoscope is used to go into the rectum and into the large colon in the intestines, the bowel. The scope is up to 5.5 feet long and is quite small, maybe the size of my finger, and flexible.
Dr. Ellsworth says many patients shy away from colonoscopy preparation. However, talking to your health provider may help create a smoother preparation before the procedure.
Colonoscopy is recommended now for everyone starting at age 45 to help detect colon cancer early. It's also recommended if someone has rectal bleeding or blood in their stool, black or bloody stools, abdominal pain, diarrhea, or maybe if they have a strong family history of colon cancer, they may want to have a colonoscopy earlier than age 45.
Patients should be hydrated during preparation for the procedure. They should not hesitate to ask their health provider, so they may suggest a more gentle alternative.
The colonoscopy procedure often takes maybe half an hour or less, sometimes up to an hour. That can depend if how many polyps there are or the reasons for the colonoscopy. It's done as an outpatient procedure, so often you'll come maybe an hour or so before the procedure, have it, be in recovery for half an hour or so after the procedure, and then go home. We recommend having someone else drive you home because of the anesthesia. Oftentimes a person, once they wake up, they're often feeling back to normal and can eat something and go home and might not have any symptom.
Ellsworth says risk of a colonoscopy procedure may vary, and to be on the lookout for any post-surgical difficulties.
As with any procedure, there's risk of infection or bleeding or pain or discomfort. There's always risk with anesthesia. The anesthesia is sedation, so it's just a matter of giving you a medication through an IV to help you sleep, and then it's turned off and you wake up again. Risk from the procedure, from the colonoscopy, the biggest risk would be perforation. That rate is quite rare and less than 1 in 1,000. Sometimes nothing may need to be done, but sometimes that could require surgery as well. That could happen from a hole or a puncture or tear in the colon during colonoscopy. There'd be risk of bleeding from having a polyp removed, and that bleeding could occur right then or sometimes could occur weeks later, so that's something to watch for after a colonoscopy.